static scap assessment. Gabe, Brian's recording, and Dre will be the subject. First of all, we're just going to start off with the norms. You want to see the scap 1 to 3 inches away from the spine. So in length, you want them to be symmetrical in height with the superior angle and inferior angle where they line up. You don't want to see any winging. The winging is when the medial border of the scap comes away from the rib cage. That's normally caused by serratus anterior muscle that's just weak, or any tilting, and tilting is you see the inferior angle of the scap elevating away from the ribs, and that's due to a tight pec. And you also don't want to see any upward or downward rotation of the scapula. So Jay, will you come over here? Thank you. So with Dre, as we discussed, normally you want to be 1 to 3 inches away from the spine. You want to see the scap. Dre, on her right side, she is 3 3/8 of an inch further away from her spinal column, and on the left side she is 4 inches away. So that is abnormal. She is in line with both, so she's symmetrical in height. There is some winging present. You see the medial border of the scap, as we discussed, coming away from the rib cage. And there is some tilting also. It's a little bit more significant on her right side. You do see the inferior angle of the scapula tilting upward, coming away from the ribs. With upward or downward rotation, see, she's in a pretty neutral position. She's not upwardly rotating or downwardly rotating. Thank you, Dre.